Hello guys, today we are going to learn about Corynebacterium diphtheria. This bacteria has a lot of characteristic features and very interesting too. So listen carefully till the end. So what is this? It is a highly infectious childhood disease which mainly causes respiratory disorders in children. This bacteria has a lot of characteristics which are difficult to remember. So I concised all of them into this small funny sketch I have drawn about a guy. Okay, one by one we are going to discuss the characteristics. First, here we can see he is wearing a purple shirt, indicates it is a gram-positive bacteria, as we can see them as purple color structures under the microscope on gram staining. Second, we can notice the funky colored dumbbell in his hands, which we can see here, which indicates the club-shaped metachromatic granules, which is the characteristic of diphtheria. These have a lot of features. Firstly, they stain dark. Second, they act as the storage places of the bacteria, but not the spores. I'm again repeating, they are the storage places of the bacteria, but not the spores. Third, we can see an uneven enlargement of his neck, indicating the characteristic bull's neck, which is very important in diphtheria. Here you can see the whitish area in his mouth, indicating the whitish pseudomembrane over the tonsils, which are also the characteristic features of diphtheria. And the wind which is present here helps you remember that it is respiratory transmitted. We can see a red heart. No, it's not love. Yeah, it does have some cardiac effects such as myocarditis. Next, we can see some out of the world hat which he is wearing while watching the TV, which looks like a nerve myelin sheath which is produced by the squamous cell, and it has a lot of perforations here you can see, which represent it is degenerated. With by that you can remember it has a demyelinating disorder. And then you can see, yeah, he's watching TV. TV, also known as television, where tele, you can remember Tellurite. Yeah, I can't get a better option than that. And he's laughing his life out by watching the TV. Laugh, you can correlate it with Loeffler, representing Loeffler serum, which is characteristic of Corynebacterium diphtheria. And last but not least, the toxins which is produced by the bacteria, toxin A and toxin B. Diphtheria is toxinia but not bacteremia. This line represents that this bacteria effects which are mainly caused due to toxin but not caused due to the bacteria itself. As the bacteria produces a toxin which consists of an A part and a B part, which is the active and the binding, which causes all the symptoms of the bacteria, except for cutaneous manifestations, which is caused by the cell itself. The rest all manifestations such as the respiratory manifestations, the CNS and the CVS manifestations, it is caused because of the toxin. So the toxin part of the bacteria is very important. Yeah, sorry, I forgot the DPT vaccine. Here you can see a syringe injecting into him, presenting DPT. DPT is nothing but diphtheria, pertussis and tetanus toxoid vaccine, which comes under pentavalent vaccine, which you will get to know soon. Remembering my guy over here is enough to ace any question given about Corynebacterium diphtheria. Just remember my guy over here who is enjoying his last minutes of his life. Okay, let's come into intro. As I have told you earlier, yes, it is a gram-positive bacteria, only on gram staining, but it has a better alternative called the Albert stain, in which you can see a greenish purple colored bacteria, where the purple color is stained by the metachromatic granules, which are the storage spots, and it has an characteristic cuneiform arrangement, which is also known as the Chinese letter arrangement, in which the bacteria are arranged in a V or L shaped as they divide from the mother cell into the daughter cell. Yeah, and the metachromatic granules, as you have seen. When it comes to pathogenesis, it is mainly toxin mediated, as I have told you, and it is rarely the whole bacteria mediated. And the clinical manifestations, it is mainly caused due to the toxins which have an A and a B part. The A part inhibits the elongating factor EF2, which actually inhibits the protein synthesis, which furthermore it just causes cell death. This is the main reason why the pseudomembrane is formed over the tonsils, as the epithelium over the pseudomembrane gets destroyed and the characteristic white layer over the tonsils is seen. The clinical manifestations of diphtheria can be majorly divided into two parts: respiratory and systemic. Respiratory, it causes pseudomembrane over the tonsils, which can extend into the larynx and trachea, and the characteristic bull's neck appearance of the neck, which is literally enlargement of neck. And systemic manifestations, in severe cases, it causes the demyelination of nerves, I have told you earlier, and myocarditis, the CVS manifestations of the toxin. Here you can see the whitish pseudomembrane over the tonsillar area. Yeah. Lab diagnosis. Lab diagnosis, I remember all the side headings of lab diagnosis like this. First, you take the specimen, then you see it under microscope, direct microscope. As we think that's not enough bacteria which is present under the microscope, so we culture it and we have enriched and selective media in it. Then after growing the bacteria, we identify what bacteria it is. There are automated identification methods and other methods. Yeah, that is how I remember the side headings. Okay, when it comes to specimen, as it is a respiratory infection, we definitely need a specimen, a sputum sample or a throat swab. The portion of pseudomembrane which is over the tonsillar area is very important. On staining it by gram staining, you can see club-shaped bacteria. Here you can see the club-shaped bacteria with two ends having the storage metachromatic granules. It is having a characteristic Chinese letter arrangement. On Albert staining, you can see green color bacilli with the metachromatic granules at the ends. Here you can see the metachromatic granules at the ends and the green color bacilli. You can see it over here properly. Culturing it. Culturing it, as we have discussed, there are two main culturing methods: low-flow serum and potassium tellurate agar. And yeah, together with it, you can even culture it in blood agar. But the specific culturing methods for diphtheria are low-flow serum and potassium tellurate agar. Potassium tellurate agar looks almost like in blood agar, and the low flow serum, here you can see the low flow serum. Identification, you have in most of the bacteria you have Malditov and VDEC, which are the automatic identification methods for almost all the bacteria. Then we have toxin, the Elks gel precipitate. I forgot to tell you, I have even added this in the diagram. I have kept an characteristic tongue which is giving it out to represent licking, lick, elk. Can you get it? Lick, elk's gel precipitate. Okay, I think you got it. Yeah, elk gel precipitate is mainly an in vitro test for the virulence factor of or different strains of bacteria. And vaccination, DPT vaccine. DPT vaccine is very important, which comes under pentavalent vaccine. DPT represents diphtheria toxoid, the whole cell pertussis, and the tetanus toxoid, D, P, and T. Treatment, you can give penicillins or erythromycin. Thank you for watching it until the end. I know it is hard to complete it. Yeah, if you really have any doubts, feel free to ask in the comment section. Thank you.